Good morning, everyone. Hi, I'm Liz Krueger, Senator for the 28th District. I am glad you could all be with us this morning. We have a very interesting group of experts. I want to welcome all the participants who are viewing on Zoom and Facebook or who may be calling in from your phone. This is the 7th session of our 2022 Boomer Senior Roundtable series. Our theme for this year has been aging in place, living well in the community. Because let's face it, it's not just about whether you're living, it's the situation you find yourself in and the opportunities you can make for yourself. This 8-part series is focused on some of the issues we need to address aging in place. As always, we have closed captioning of today's event. As a viewer, you have to activate closed captioning to view the text in your device. If you're on Zoom, click on Live Transcript in the meeting controls to start viewing closed captioning. If you're on Facebook Live, you'll see Settings button in the bottom right hand of the video. Click Closed Caption, CC, to start viewing the text closed caption style. This forum is being recorded, and everyone who RSVP'd or reaches out afterwards can receive an email with a link to the event video and all the resources that we're going to be posting in the chat within a few days, along with the presenters' PowerPoints. So just know that if you're following along with chat, that there will be information popping up there, but don't think you need to write everything down for yourself. You can get that from me afterwards. Before we go to the program, I always like to do a couple of COVID updates because, yes, I know we still have to deal with this. It isn't gone yet. In New York City, our COVID-19 alert level continues to be low or green. Due to the recent increase in community transmission, however, the New York City Health Department strongly recommends New Yorkers wear a high quality or double mask when in public indoor settings, especially if you're at risk of severe illness and if you do not know the vaccination status of other people present. And let's be honest, we never can totally know whether everyone around us has been vaccinated and boosted or does not have an active case. So let's just be common sense smart. Any questions, any doubts, put on the mask. Too many people in too tight a situation, decide not to participate with that one. Wearing a mask on public transportation in New York is still required due to a state requirement that is in place. Testing continues to be very important in helping to manage community transmission and to accessing treatment for eligible individuals. You can get COVID-19 testing at no charge at city-run community testing sites. You can also pick up free COVID-19 at-home rapid tests at city distribution sites. And if you test positive for COVID-19, please speak with your healthcare provider to discuss eligibility for treatment. If you do not have a healthcare provider, or if you are uninsured, you can call 212-268-4319, 212-268-4319 to inquire about treatment eligibility. Nobody should end up with COVID in this city and not think that there's a healthcare provider that they can get to right away. And then we're going to move on to today's event. I know that many of you feel frustrated by and occasionally defeated by technology, especially when you watch young people. Even small children seem to know genetically how to handle this stuff. But most of you are watching this roundtable on Zoom or Facebook. And so if you can figure out how to use these tools, you can definitely figure out how to navigate other technological challenges. Today we will hear about tech classes designed specifically for older adults that take into account how we access and process information. You will also learn about new tech products, including information about devices to help individuals with hearing loss. For example, you've got text options on every web event that you'd like to go on at this point. Finally, if you believe that tech devices are designed without our needs in mind, today we will hear about research from MIT's AgeLab dedicated to improving tech product design and committed to including the older adult perspective. Yay! We have a lineup of really terrific speakers today. First, we will hear from Marco DiGirolomo, who is the New York State Director of Senior Planet and Older Adult Technology Services, or OATS. Marco will give you an overview of the programs and services that are provided by OATS, and we've worked with them for years, and really we hope everybody will learn about them and see the advantages of being able to participate. Following Marco, Carolyn Ginsburg Stern, who is the Director of Outreach and Strategic Initiatives at the Center for Hearing and Communication, will share information about tech devices to assist people with hearing loss. And she will also give us the most current information about the over-the-counter hearing aids we're seeing advertised everywhere. After Carolyn, Greg Olsen, the acting director of the New York State Office for the Aging, will share information about New York State's award-winning animatronic animal initiative. Ooh, say that 3 times fast. Animatronic animal initiative to address isolation and loneliness in people living with dementia. And our last speaker is Chaiwoo Lee, who is the research scientist at MIT's AgeLab. Chaiwoo will tell us about the AgeLab and their mission to include older persons' needs and perspectives in technology design. Just to remind you before we start, we will have a Q&A session after the presentation. As always, we have received some questions in advance, but you can also submit questions through the Q&A functions on Zoom and Facebook. So now it is my pleasure to introduce Marco DiGirolomo from OATS. Hi, Marco.
Hi, Senator Krueger. Thank you for having me today. I am going to share my screen and present. Great. So as Senator Krueger mentioned, my name is Marco DiGirolomo. I am the New York State Director for Older Adult Technology Services Senior Planet from AARP. And to get started, I wanted to give everyone an introduction to Senior Planet, for those of you who haven't heard about Senior Planet before. At Senior Planet, our motto is Aging with Attitude. The motto really highlights what we do at Senior Planet, which is empowering older adults to age with attitude and not think of aging as something negative, but think of it as something empowering. And to empower them, older adults, technology is that avenue. So as technology becomes more and more enveloped in our everyday life, we are the go-to individuals to show older adults how to use technology in a safe and easy way, and it's all free of charge to adults 60 and over. Senior Planet's training model involves 3 types of programs. We offer 5 and 10-week digital literacy programs that start off from foundational, how to use a PC, computer, or iPad, and from there it goes into how to use social media, how to become more active in your community through civic engagement, how to be more health conscious. And those courses, as I mentioned, are 5 and 10 weeks long. And then we also have one-off hour-long lectures. All of our curriculum is designed with and for older adults in mind. So whether you are a novice or you are an expert in the topic, you will leave any of our sessions with some piece of knowledge that you didn't really know before. All of our curriculum is developed with mainstream devices and applications in mind, being that the point of what we're looking to do is empower individuals to become more involved in everyday life. And, jitterbugs and consumer cellular are great options, but we also have the iPhones, which sometimes may seem a little bit more daunting, and those are the mainstream devices. And then there's also an emphasis on partnership. So when you come into a class or you come into a lecture, it's not an individual experience. You are learning with a group. There's activities with it built into our curriculum where you learn as a group. Next, I'm going to give a little bit about OATS, Older Adult Technology Services. People sometimes get the two confused, but in short, Older Adults Technology Services is Senior Planet's parent organization, and we are affiliated with AARP. OATS is a social impact organization with the mission to harness technology to change the way we age as a society. OATS is the creator of Senior Planet, as I just mentioned, as well as Aging Connected, which is an initiative to bring 1 million older adults online by June of this year. So in about a month, we will have those numbers in. OATS works with nonprofits, corporate partners, and government organizations to bring innovation solutions to the intersection of aging and technology. And Senior Planet is the consumer-facing older adult brand. So how do we think? So Senior Planet courses and lectures, we have over 70 pieces of material created. We have the device essentials such as iPad, PCs, and Chromebooks, which I mentioned earlier, and they are available in 5 languages: Spanish, Bengali, Russian, Mandarin, and Cantonese, and in English as well. And then we have a plethora of other programs such as our Money Matters course, which shows older adults how to safely access online financial material. So whether it's online banking or shopping online, we show how to do that in a safe and strategic way that you can ultimately save money. And in those financial literacy programs, we also show how to watch out for scams and how to pinpoint what is a legitimate financial website and what is not. We also have our entrepreneurial programs such as Startup, where if you want to start your own business, we have a program that can help you conceptualize that. And then once again, we have our health and wellness programs as well as our advocacy programs. In addition to our programs that we offer that you come in and there's a technology trainer, we also have an asynchronous option, which is called Senior Planet U, where you learn at the comfortability of your own pace. And that is all through a modular offering. I mentioned briefly earlier that we offer health and wellness, financial literacy programs, but we have 5 particular impact areas, which no matter what course or lecture you take, you will touch on at least 3 of the 5 in any given program. So we have the health and wellness programming, we have the social engagement programming, we have creative expression, financial safety and literacy, and civic engagement and advocacy. We also have our website where we have over 1 million visitors each year. Our website is where you can go and find articles that are geared towards adults 60 and over, and they touch on a variety of topics from dating to new tech that's coming out to social issues that impact adults 60 and over. So that's your one-stop shop to get great content about what's going on in the world. In addition, we are on our website, we have our virtual program offerings. We have over 75 programs each week, and that covers a wide variety of topics that are under all 5 of our impact areas. And in addition, these are some takeaways and resources. We have, as I mentioned, we have seniorplanet.org, where you can go and you can find an immense amount of information about what we have to offer virtually. And as we begin to safely reopen our center in Chelsea, New York, you can find what programs we are offering in our Chelsea center. We also have our Aging Connected program that I mentioned earlier, where if you go to agingconnected.org/ACP, you will be able to find information about the Affordable Connectivity Program, which is a program that gives subsidized internet connectivity prices to qualifying individuals. And there is also a stipend for qualifying technology as well. Our online resources, which you can find on seniorplanet.org, in addition to the classes and articles, we have handouts and available information about various technology topics. We have tech tip videos as well as Zoom video resources, and also COVID resources as well. If you want to learn more about what we have to offer at any of our locations, we have newsletters that you can sign up for as well. And you receive a newsletter every Sunday morning about what's going on in our New York City location. And then there's a larger overarching newsletter that covers all of our programs across the country virtually. And if you have any tech help needs, that you need help, say, troubleshooting your phone, or you got locked out of your email, we have a national hotline that you can call, and that number will be added to the chat momentarily. We are open from 9 a.m. to 8 p.m. Eastern Standard Time, and we have our technology training staff that answer those calls, and they will be able to assist in any way possible. And other than that, I would like to thank everybody for having me here today, and look forward to the Q&A. Thank you.
Great. Thank you so much, Marco. And I certainly encourage everyone to take a look at the materials and go on their sites, because there is no way you're not going to find something that you are interested in learning more about. I can almost guarantee you that. Next, we will hear from Carolyn Stern from the Center for Hearing and Communications. And Carolyn focuses on outreach and strategic initiatives. So good morning, Carolyn.
Good morning. Is everyone seeing the screen?
Yep.
Yep.
Okay. Okay. So thank you for having us today from the Center for Hearing and Communication. I will be covering how technology can help you manage hearing loss in the home. Okay. In addition to introducing our agency to you, I will spend time talking about how technology for hearing loss can help you remain independent and safe while spending time or extended time in your home, as well as how to manage hearing loss from home as well. So first, our clinic is based in Lower Manhattan, and we provide services via telehealth or in person. We've been around since 1910 and help people with all degrees of hearing loss of any age, from infancy through older adult. Our vision is communication without limits, and we really take the time to work with individuals to understand your specific hearing health issues, your hearing levels, your lifestyle, your tech ability, and try to match solutions so that you can live a full life, even with a hearing loss, no matter what the degree is. We have we have 4 clinical areas, and including outreach. The biggest department is audiology, which may be most relevant for you. We do hearing testing. We fit a wide range of different types of hearing devices, hearing aids, and we also do repairs. We have walk-ins as well for clients, as well as individuals who are not existing clients. And we also have emotional health and wellness services, which can be very helpful for someone adjusting to a hearing issue, as well as a number of other clinical support. So when it comes to managing hearing loss in the home, I want everyone to think a little bit beyond hearing aids for this presentation. Hearing aids really are the gold standard today. The technology is incredible, very, very advanced. And if you are well fitted with a hearing device with the partnership of an audiologist, you will probably do very well. But in addition, there are many other solutions out there that can be very helpful. And these solutions can improve audio in the home for the TV, the phone, the doorbell. There are visual solutions so that you can use your other senses to be aware, better aware of your environment, such as a flashing light can alert you if a doorbell is ringing, for example. There's captioning available now for the phone and the TV. So that's another way to support someone with a hearing loss to use their vision to help them understand what's being said. And then there are other solutions that can send a touch alert through vibration to alert you that something is going on in your environment. So there's a wide range of assistive devices out there that can inform someone with a hearing loss that something's happening in their home. For example, an alarm clock going off, that if someone's wearing hearing aids, but they're sleeping and they don't wear it when they sleep, they may not hear it. There are ways to be alerted that the alarm's going off through a flashing light or a vibrating device. For example, on the slide, there's a picture of an alarm clock with an attachment that looks like this. I'm holding up a vibrating device that plugs into a very specific type of alarm clock that will vibrate under your mattress or pillow when the alarm goes off. And then there are a slew of other products that you'll see on the slide that can alert you if the phone is ringing, if the fire alarm is going off, and they can alert you visually or through touch, or even an extra loud audio sound. All of these products are available from various companies, and the resources are available at the end of the presentation on one of the slides, and you can also access that through Senator Krueger's website as well. So when it comes to smartphones, I wanted to encourage you to explore in the settings of iPhones and Android phones. There is a category called accessibility, and a lot of people are not aware of this. So take a few minutes to look in the settings feature of your phone if you have a smartphone. And on here are two examples of built-in free features for iPhones and Android phones that will alert you of the environment, of your environment. So if you'll see on the left, if I don't know how well you can read it, but this is an image of what the accessibility feature called sound recognition. And if you tap on that in the settings, it will give a list of the different sounds in your environment that you might want to be alerted of. For example, a fire alarm, water running, a dog barking, the doorbell ringing. You can toggle and turn on any of these alerts, and the phone will actually it's programmed to listen for these sounds. And when the sound is detected, for example, a door knock, the phone will alert you through a notification. Either it will send a text message to you, it will alert you with a visual light, and or it will vibrate. And if you wear a smartwatch like I have on my wrist here, it will even send you a vibration notice to your watch, and it will tell you what's going on. So that's a wonderful free way to be a little more aware of what's going on in your environment and to remain safer. So I encourage you to explore that. I also wanted to tell you that there are many apps out there that can couple with products such as a wireless vibrating shaker, like the one on the slide or the one I'm holding up that's light blue. And you can pair it with an app on your smartphone to set an alarm. So if you want to wake up at 6:30 in the morning, you can set the app on your phone that's connected wirelessly to this device. You place this device under your pillow, and then you put your smartphone on your nightstand or somewhere else in your room and set the alarm up. And when it's 6:30 in the morning, this little device will shake under your pillow. So that's another way to stay alert and be able to connect to your clock when or your smartphone using an alarm if you can't hear it. And there are also ways to pair this with a smart speaker. If you have a smart speaker in your phone, like on the slide here, we have an Amazon Echo Show. And then there are ways to also pair using an app, using smart bulbs on the slide that you have here that can also alert you visually when the alarm goes off. So there are many different ways to use technology to keep you alert of your environment. So I wanted to move on to the other category that a lot of people struggle with hearing loss, is being able to hear well enough when they're using the phone or watching TV shows through the TV or streaming. And there are generally two different ways to help the situation. You can either on the left enable captioning or enhance the audio signal. And for captioning, there are many companies that now provide free captioning, either on a landline phone that's specifically designed for captioning services, or an app on a smartphone or a tablet. Some of the companies are listed here on the slide, and I encourage you to explore those. They can really make a difference. Essentially, what it's doing is it's captioning the conversation in real time. As you're hearing the spoken language, the written text of the conversation is showing up on the screen so that you can follow along better. And I encourage you to look into captions on your television. It's a built-in feature that can be activated using the remote control that comes with the device, or in the settings on the tablet, or you're watching it on a smartphone as well. And then there are ways to enhance the audio. There are many different attachment devices that can be used with a landline phone and or a cell phone. There are ways to pair a device to a smartphone that will amplify the sound of the audio. And these days, hearing aids are very advanced and can be paired directly with a Bluetooth-enabled landline phone or smartphone, so that the audio from the smartphone or the landline will transfer directly wirelessly to the hearing aid, and that will enhance the audio of your phone call. And the same can be done with a TV. You can get an accessory to be plugged into the back of the TV that is compatible with the hearing aid, and it will send the audio wirelessly to the hearing aid and really help improve your ability to hear the TV by reducing the distance between you and the screen. And then there are other types of headsets that you could get that are personal listening headsets for the TV, that you can listen to it at your preferred volume. You can get multiple headsets and everyone in the home can listen to the show at their preferred volume. So lots of different options out there to help you. And the last part that I wanted to talk about today is managing the hearing loss from your home. Some people may not be able to readily visit an audiologist because they're homebound, or they're not able to get out, or you're not sure. You want to kind of know whether or not it's worth seeing an audiologist, someone who is an expert in measuring hearing loss. So there are apps and online hearing screenings available that are free. And on the slide here, there's an example of an app called Mimi that you can download for free and test your hearing using a smart device, either a smartphone or a tablet. There are many hearing aid companies that offer a free hearing test. And the one on the slide here is an example of a survey that you could take online, and it will, based on your answers, will provide some guidance about what you should do next. And on the Center for Hearing and Communication's own website, we offer a free hearing screening that can be used on a computer, a tablet, a smartphone, or a laptop, and any type of headset or wired or wireless earbuds. And it takes less than 5 minutes, and it will give you a good indication of whether or not you likely have a hearing loss. It's a screening, it's not a full hearing test. And we will offer, if you're interested, you can reach out to us and we can provide a 50-minute consultation by phone or video. So these are just some examples of lots of different ways from your own home, you don't have to leave your home, to get a read on how you're hearing. And finally, I wanted to cover the new category of hearing aids that we'll be launching officially in the fall of 2022. So currently, the traditional way to obtain a hearing aid is through an audiologist, where you can see them at a hospital, a nonprofit clinic like ours, or a private clinician at a private practice. And this new category will enable consumers like you to purchase a hearing device that will be federally FDA regulated, with that it has to meet very specific requirements before it can be called an over-the-counter hearing aid. And you can obtain these on your own. You do not need to work with a hearing professional to get it. You can likely order them online or obtain them in a retail setting, like a local drugstore or Best Buy, for example. And they're only for adults 18 and older. They're not for children. And they're meant for people with a perceived mild or moderate hearing loss. And I say perceived because right now the federal regulation is not requiring a hearing test to purchase the devices. Whereas the traditional way to obtain a hearing aid, which will now be called, once this product launches, the hearing aids from an audiologist at a hospital, a clinic, will be called a prescription hearing aid. And those you would need to obtain through a professional. Now, many of these devices will require a smartphone device to set up the hearing aid. So you will have to assess whether or not that's the right approach for you. If you're not very tech savvy, this may not be the right type of product for you. And from us, we're in the business of hearing healthcare and really helping individuals find the right solution. We highly, highly recommend, even though it's not required, but we believe the first step is to get a hearing test. And you can get a hearing test from any of the health providers settings that I had just mentioned, and their hearing tests are covered by Medicare and Medicaid. So that's free, essentially free under your insurance. And that would be a really good first step. And then after that, you can explore whether or not the OTC hearing aid is the right solution for you. More to come. The products have not officially launched yet. You will probably see some of them already online, but they're not officially federally approved yet. So more to come in that category. And finally, I just wanted to share with you that there are many resources available for all the products that I mentioned today. And so take a look. And this is my contact information, and I hope that this was informative for you today.
Great. Thank you so much, Carolyn. I just want to mention that at one time, a couple of years ago, I had a good friend who didn't want to have a hearing test, but we were convinced he really needed it. And so I made an appointment for him, myself, and my husband to all come to your center and get tested for hearing so that he wouldn't be doing it alone. And sure enough, you all recommended hearing aids for him, and he got them right away, and it's changed his life. But you also said I had a hearing problem, but we're on the border about whether or not to have hearing aids. And so it was about 1.5 years later that I actually ended up choosing to get hearing aids because I was having trouble hearing debates on the Senate chamber, which is this giant room. And then some people would come whisper in your ear, and then other people would be talking through these lousy microphones from across the room. And I have to say, I mostly use the hearing aids for that setting, but it's amazing how helpful that is. And I am so glad that we went and we got diagnosed and we started to think about the options for ourselves. And so I'm a big believer in people getting their hearing tested. Sometimes you don't know that it's gotten away from you, but there are many options available, which we've just learned about. So I really appreciate the work that your whole center does. And just want to reemphasize to people, there's no shame in having hearing loss. Huge percentages of the public do, and there are options that can dramatically help you in your life. With that, with someone who spends, I think, all of his days focusing on how do we make life better for older adults, the director of the New York State Office for the Aging, Greg Olsen, who's here with us. I'm sure he just wanted to be on it because it's very hot to be on these web discussions that we run, but also to talk about this model program that the State Office for the Aging is running. Hi, Greg Olsen.
Hi, Senator, and thanks. It's so great to be here. It's great to see there's 290 people live, and I'm sure many, many more as you're broadcasting this out. So I want to thank you for the invitation and our longstanding friendship and partnership, Wendy and your entire team for putting this together. You have an amazing panel, so I'm really thrilled to be a part of that as well. You know, there's a lot of technology options that have existed, but have certainly exploded through COVID-19. That are really helpful. Now, it's not a replacement for in-person or connecting with people together, but it's an additional tool in the toolbox for a variety of things, from combating isolation to seeing your doctor, to things that Carolyn had talked about, aids and other types of things that can assist you in your home to age in place. And I love the way the Senator couched that, because that's what the Office for Aging and our 59 county partners in New York City, it's the Department for the Aging, and our 1,200 community-based organizations do, is work with older adults and their families to help them maintain their independence for as long as possible with dignity. The state office has launched many, many projects over the last 2 years in partnering with tech companies and startups to really bring digital programming to older adults and to teach them how to use the equipment. And I'm really thankful that Governor Hochul sees the value of that and has put almost $3 million additional dollars in our budget this year to, develop new initiatives or expand things that we've already tried. So what I was asked to talk about today is our award-winning animatronic pet project. And I have to tell you, I've been doing this work for 30 years, have developed and implemented a lot of different projects and programs. And this is really one of my favorites. For a very, very small amount of money, you can change somebody's lives. What we know as human beings, regardless of age, is there's things that make us tick, right? That we really are interested in: cultural events, music, art, and of course, pets. So I'm thrilled to kind of walk through what we've done and how that's really impacted not only New York, but really the nation. So if you could pull up my slide deck, that would be great. Next slide, please. Thank you. So I'm just going to start with a little background, because our network has for a long time been trying to address social isolation, but those things have been done really in person: friendly visiting, phone trees, linking with high school and other students or volunteers. But early on in 2018, AARP Public Policy Institute released a study with CMS that really aggregated the impact of isolation on older adults and showed that Medicare spent $6.7 billion a year in additional spending for individuals that were deemed isolated and lonely. There are clear risk factors for illness and death when you're lonely and isolated. The spending is comparable to people that have arthritis, high blood pressure, heart disease, and diabetes. And it's actually similar to smoking almost a pack of cigarettes every single day. Next, please. There's a picture of an individual receiving one of our pets. I have to give my daughter, Anya, all the credit. I came home from work one day and she had ordered one of these pets online. And I am not kidding, when I saw what it would do and how it worked, I said to her, this would be an amazing project to test with some of our community dwelling older adults who are lonely. So I had reached out to some of our counties. We got 12 counties to participate in a pilot. We bought 30 dogs and 30 cats. We found a loneliness scale. It's a 6-question scale that measures social loneliness and emotional loneliness. And we utilized that tool before somebody received a pet, and if they triggered that they were isolated and lonely, and then at 3, 6, and 12 months thereafter. The results were overwhelming. There was a significant or reduced reduction in loneliness and isolation among 70% of the participants. In one of our counties, smart enough, actually embedded a pain scale along with the loneliness scale. And they saw a 75% decrease in pain after 1 year, where individuals were indicating a 9 or a 10 on the pain scale, and then that reduced to a 1 or a 2 after a full year. So that was all that I needed to try to test the efficacy of this, because I know how important pets are to individuals. There's a variety of reasons why Older adults may not have a pet anymore, or can't take care of a pet anymore. And this was a way to really address some of the isolation. So through COVID, we have purchased over 3,500 pets and distributed them to our county offices for the aging. We have over 800 state certified case managers that work day in and day out with older adults, so they know who would be a good individual for receiving these pets. I want to be really clear. We did not test this with individuals with cognitive impairment at the outset, because I didn't want to do any harm. I didn't want to test something that would actually have a negative impact. So these are individuals that live all throughout New York State that trigger that they're isolated and lonely. But since we've done that, we've worked with federally qualified health centers, the Office of Mental Health, veterans agencies, nursing homes, assisted living, that are all purchasing these as well. And the pets are available for anybody to buy. We have a discount code specific to our state, and the code is NYS20. They cost about $100, a little over $100, but with the discount, it would be around $100. Next, please. So why did we focus on this? Because we knew we had a problem. We saw the data from AARP and CMS, and then we look at who we serve day in and day out. Our average customer is an 82-year-old female who lives alone, who is low income, and has a high number not only of chronic conditions, but a bunch of functional limitations, and I've listed them there. So they are the perfect group of individuals to test this pilot project to see what the impact would be. Next, please. But since our study, there's been a variety of other studies, both within the Veterans Administration and nursing homes with individuals with Alzheimer's disease and community dwelling older adults. And they have proven to reduce anxiety and agitation and the use of medications. They improve the mood and well-being and decrease depression. We found that as well. It improves cognition, reduces delirium in hospitalized patients, reduces the burden of care for caregivers. I think that's really important. We saw that the concern or that caregivers had for a loved one was actually decreased because of the engagement. And then I think one of the most important things, Alabama replicated our model. And what they did is they took a look at the engagement with pets over the year. And I think this is really important. When individuals receive the pet, I mean, it gives you chills when you actually look at the videos, and we have all of these posted on our website, pictures, but you wonder, do you engage with it and then it goes on a shelf after a week or two? And the answer is no. The engagement actually increases every month that the individual has the pet. And when NBC in New York State did a story on this and interviewed me, I found myself totally unconsciously, as I'm talking to the reporter, petting the cat and engaging with the cat. And I had no idea I was even doing that. Next, please. So what's next? We just put in an order because we had additional dollars in our state budget. We were able to work with our association to secure additional funds and a little bit of admin money. We just ordered almost 8,000 pets. We're going to be putting out another 3,452 dogs, a little bit about 2,200 cats, and a new product called the Walker Squawker. So what is that? It's a artificial intelligence bird that fits on somebody's walker that can recognize if somebody gets up and isn't using the walker and reminds them to use the walker. The whole purpose of this is to, again, get folks to make sure that they're using their walker, so it reduces the risks of falls and injury-related falls, which we know can be devastating for older adults. So we are going to be working with the Teresian House. We have a call today. They're a nursing home here in the Capital District to test the efficacy of the Walker Squawker on the reduction of falls or the risk of falls. So I'm really excited by that. Next, please. As I mentioned, we received an award last year, a statewide award voted on by our peers for a Population Health and Innovation Summit for targeting the effects of social isolation. And as I mentioned, I've had the honor really to represent New York State across the country in our pandemic response, in speaking with many of my counterparts and other aging folks across the country at least 20 times over the last 18 months. And this project has been replicated by more than 30 states. And as I mentioned earlier, is in many, many other systems like assisted living, nursing homes, veterans, mental health, federally qualified health centers, and others. And I believe that is it. But I will tell you, I think Oates talked about the motto. A great motto is, if you can change somebody's life for $100, why wouldn't you do it? And this has just been a spectacular project. And like I said, when I see the videos, I just get chills because it's so meaningful to individuals that might have lost a pet, haven't had one for a while, had to give one up because they couldn't take care of it anymore. Like I said, it's not a replacement, it's a value added, an additional tool in the toolbox.
Thank you very much, Greg. I've actually had some personal experience purchasing a cat for a family member with dementia, and the response was amazing. Exactly how you described it. And so I'm so glad that you're here with us today to let people know about the program model, but also for people to understand that these are available for sale and you can buy them for someone that you are involved with who this might be a really significant addition to their daily life. So thank you.
And Senator, we just purchased a whole bunch for the naturally occurring retirement communities down in the city. That was not part of the count that I just gave you. So those are en route. And then DFTA, of course, ordered a bunch that we send directly to community-based organizations throughout New York City. So thank you so much for asking me to be a part of this great panel today.
Great. Thank you very much. All right. Our last speaker, certainly not our least, our last speaker, again, is the Designing Tech with Older Adults in Mind research scientist, Chaiwoo Lee, who has joined us from MIT's AgeLab. Good morning.
Good morning, and thank you for the introduction. Very excited to talk about some of the work that we're doing at the MIT AgeLab, and also to talk a little bit about some of the design approaches that we see out there that could be used to improve technology design for older adults. So I'm going to share my screen. So my talk is titled Older Adults and Technology, Putting Users at the Center of Research and Design. So I will talk about some of the approaches that are out there to make sure that older adults and their needs are considered during the research and design of technology products and services. So efforts that are out there to make sure that technology is designed in a way that they can really work for you and that can really be useful and be easy to use. And I'll also start with the introduction to the lab, kind of who we are and what we do generally, some of the design approaches that we're considering, and also some of the design examples at the lab, and thinking about what are the different application areas, different domains where we see increased use of technology for an aging population. All right, so our vision at the lab is 100 years of quality living. So we're not really interested in thinking about the biological aspect or the medical aspect of aging, but really thinking about what is there in terms of opportunities to create and innovate. We see too many times that aging gets framed as a problem to be solved. And we actually have some people, some organizations, companies approach us with questions like, this is such a big problem to be solved. What are the solutions? And that's really not the angle that we're approaching from. We think about how do we put together different ideas and technological possibilities, and really think about different ways to make our lives more engaging and more connected throughout our lifespan. And we do academic research. We do a lot of academic work, but we also do outreach activities. So we engage with the local and other communities around us. We also engage with other resource organizations, senior living facilities and retirement communities, and education organizations to make sure that our ideas and research gets across to places that they would really matter. And we're really dedicated to improving quality of life for older adults and those who care for them. And we really think that population aging poses an opportunity for different domains, different fields of study, different application areas. So our team of researchers really consists of people from different expertise and different backgrounds. So We have researchers coming from a design background, engineering, policy, sociology, psychology of different kinds, public health, consumer behavior, and more. And we work together to make sure that what we're creating is not just solving one problem or not just addressing one aspect of what we're seeing, but really trying to holistically think about what opportunities we might be able to harness. So what we see in terms of technologies that are out there for older adults, and a lot of newer technologies and newer services are tackling some of these issues, but traditionally we've seen a lot of focus on simplicity and safety. And these are critically important, but in some of the more traditional systems and products and services, these have been the sole focus. And we ended up seeing a lot of devices and solutions that are targeted for older adults that could really improve their safety and their well-being, just don't get adopted, and people just don't like them. So what we're seeing is that simplicity and safety are important, but there's really more to older adults' needs and wants. So it's not just about usability itself, but more, possibly more about what's desirable by older adults. And also we see a lot of messaging around appealing to fears. So you see commercials out there saying, I've fallen and can't get up. But where are the aspirations and where are the status that people really want to be in? Often designers who are making these products, making these messages, don't really share the same characteristics and experiences that their older users have. So oftentimes these are younger people who don't really have an in-depth understanding of what the experiences might be. And oftentimes they end up relying on assumptions and stereotypes, and they get reflected into the design. And we see a lot of issues around the prevalence of ageism in technology design too still. While when you actually ask older adults, we don't see a lot of the stereotypes being reflected in what they're saying. So as this statistic from the Pew Research Center says, not a lot of people identify as old or feel old. So the stereotypes that get built into the design are not really well received by their intended users. This is one way of our perspective on how we view the different needs and wants that people have as they grow older. So again, health and safety and simplicity, those are important, and health and safety need to be there to make sure that other needs are being met. But there is higher level needs such as connectivity, engaging with others, communicating with others, having leisurely activities. There's also the need to continue to contribute and to learn and to leave legacy. So there are higher level needs that might actually be more important for people that just aren't being addressed yet. So some of the approaches that we're thinking about in our research and design to make sure that the needs are holistically considered and comprehensively addressed. One of those is to think about universal and ageless design. And traditionally, older adult products that are targeted for older adults got labeled as old people products, and they were designed in ways that would really signal the characteristics of the user. So phones with limited functions and big buttons, while those might be easy to use, we heard from a lot of older adults saying that they don't want to carry that device. So we're thinking about designing products and services and environments that could be accessed, used, and also liked by people of all ages and abilities. So universally usable, accessible, and also universally appealing. And thinking about user-centered design approaches. So as a product or service gets designed, instead of having a fundamental technology derived a design or have it built around assumptions and the designer's own observations, having a higher focus on the users. And from the very beginning of the design process, considering the needs, priorities, and experiences of the needs and throughout the design process. And we also think a lot about co-designing and getting users involved in design. And that's something that we're also trying to do in our research too. and having users get involved as much as possible to have them voice their needs, provide their own ideas, evaluate concepts along the design process, and to provide feedback that can get built into the design too. So I keep saying a holistic approach here and there, but how we approach that in some of our design thinking is to understand the complexities in user experience. So again, for many products that we see out there, the sole focus was on usability, but we really see that user experience really encompasses a much larger set of experiences than that. So while something might be easy to use, very simple to use, it might still get ignored by users because it doesn't appeal to their emotions or doesn't facilitate learning, or it doesn't fit their mental models around how something should work. It's not something that's compatible with their past experiences, their values or beliefs. So the considerations that go into using, adopting, and keeping a technology product or service really goes beyond usability. And we also see these factors coming into having important roles across the adoption and usage stage. So the traditional view of looking at technology adoption was that there's a technology, there's a product, service, someone buys it and that's it. But we see that there's a lot of research and learning that goes in before that purchase or subscription happens. And then the usage and experience continuously gets evaluated. And there's multiple points of decision-making that happens when someone gets something, actually starts to use it, decides to continue use it or not. So really thinking about different set of factors that may go into people's experience and when those factors come into play. And this is the approach that we're taking in our design efforts. So talking a little more about some of the design examples that we have and the domains that we're looking at. So we really see aging of the population affecting different areas of the society. So thinking about transportation, for example, driving could change with aging as some people inevitably experience declines in physical and cognitive capabilities. Also, aging could have impacts on how communities are designed, how our cities are designed. So thinking about the community design aspect as well. And thinking a lot about the home, because that's where a lot of things happen, and that really got intensified with COVID-19. Thinking about how the home is not just a place now, but there's so many devices that are in the home, and we've seen a tremendous amount of new adoptions due to COVID-19 in terms of home technologies and home services. So how are people navigating this as older adults, as caregivers? We do also research around family caregiving. So we think about how families are caring for another, how daughters and sons and granddaughters and sons are caring for their parents, their older relatives, and what that experience is like, what kinds of tasks are involved, and what kinds of solutions can we develop to make sure that it's a more enjoyable and easier experience for caregivers and care recipients. And we also generally think about retirement and future planning from a more financial perspective. So thinking about how are people viewing their post-retirement lives at an earlier age, and how do we drive behavior change so that people are actually prepared for the needs that might have, the 30, 40 years of life that might lie beyond retirement. So I just have a few examples of what questions we're trying to answer across these domains. So one area is the home. And again, tomorrow's home might not look like what they look like right now. And we might actually be seeing a transition into homes being a platform for technologies and services, and all kinds of different brands and networks entering our homes. And there's a lot of devices that are out there, sensors, individual devices that may promise individual benefits, but where we see the problem is that they're really not integrated. And this is not just difficult for older adults. For someone like me, for example, who actually studied this field, I've studied engineering for half of my life, but I've had a lot of difficulty figuring out if my doorbell is going to work with my smart lock, for example. And this was this was not an easy learning curve. So we do research around prototyping how these integrations might happen, and actually going to the users' houses to ask them what frustrations they have right now, and thinking about how new solutions might be able to address some of those needs. Taking our prototypes to people's homes to have them use it for some periods of time to provide us with feedback so that we can continue to improve our ideas and to communicate that with the larger research community. And also trying to develop a language around what future homes might look like and what a smart home is, because there's no clear definition out there. And that's really making it more confusing for consumers and users to know what's going to work for them. Another major area that we do a lot of research in is in transportation. So understanding the human factors of driving, the physical and cognitive aspects of driving, but also thinking about the self-driving future that may be in a few decades from now. And thinking about how are consumers understanding self-driving? Do people see that as a future possibility? And we do a lot of simulator studies, on-road experiments, and larger online surveys at the lab to try to get people into these environments and to provide their thoughts around the in-vehicle technologies that we see right now and that we might see in the future. This is an example of one of our research tools. This is called Ageless, Age Gain Now Empathy System. And this is a tool that we use with many of our partners, sometimes with our students at MIT and Harvard, to get them into the minds of designing with empathy. So instead of assuming what the experiences might be like, trying to understand and experience some of the pain points, some of the friction, frustration, and fatigue that might come with the physical aspect of aging. And this is, we found this to be really useful because once you put a designer into a suit like this, and this doesn't simulate everything that comes with aging, but it gives people the aha moment to open their eyes up to new possibilities and to think about some of the issues that they might not have thought about before, and to think about new ways of approaching, and to open their minds up to thinking about having the users be more involved in what they're trying to address. So that is all I have, I think. Yeah, and I'd be happy to answer any questions.
Great. Thank you so much. I think we have a lot of questions just right before we get to them. Again, we have many questions. We are running a little late, but that's okay. It was because you were all so excellent. Many people who sent in original questions were really asking about individual tech issues for themselves, and we won't be answering most of them, but we will be listing several organizations in the chat that can provide technical support to you for individual problems you're having. Also included is a link to several tech guides from the organization DiGirolomo. The link is in the chat and will give you easy access to understand instructions with pictures on how to use your Apple equipment, your Android equipment, your iPad, and other devices. And of course, OATS is really designed also to assist with all of these equipment issues. I'm including information as well about how to get a copy of my senior resource guide, which has numerous resources on aging in place and other vital services for older adults. And you can access the guide online. The link will be in the chat, or you can email us at my government website, lkrueger@nysenate.gov. It'll be in the chat, or call my office, 212-490-9535, and we can mail you a printed out copy of the guide. It's a pretty big guide, so trying to use it online can be a little bit overwhelming. I actually do recommend people get themselves a hard copy. And just to remind you, we will email you a list of all the resources that we've been talking about, or that my special guests have been talking about or presented in their PowerPoint. We'll be emailing that to all of you a day or two after today's video event. And so we're going to start the questions that were sent ahead, and you still have an opportunity to submit questions through the functions on Zoom and Facebook. I'm just not sure how many we'll be able to get to since we are running late because we had such good presenters. So let's start with low cost resources. Oh, and I'm sorry, if all of my guests would put themselves back on and their audio back on, and then anyone who thinks they have an answer, jump on in. Are there any low income resources for those living on fixed incomes in our community that you think wasn't mentioned so far today but might be helpful, including things like free tablets?
So I can jump in. As I, in my presentation, I spoke about the Affordable Connectivity Program. With the Affordable Connectivity Program, for qualifying individuals, socioeconomic being one of the qualifications, individuals who qualify get a lower cost internet service from participating telecommunication companies, but there is also a stipend for devices as well. They're select devices, but I don't believe they're completely free, but they are at a much lower cost than typical market price if you were to go to the store.
Yeah, can I build upon that? So that's exactly what I was going to say. The monthly fee is a $30 discount. So the average cost is about $60 a month for internet connection. So that would mean for those who are at 150% of poverty or less would get a $30 discount. And the value towards the equipment for those same individuals is $100 off the purchase of a tablet, smartphone, and the tech equipment. We also have put out about $160 million of stimulus funding, and that goes through the offices for the aging. And certainly there are priorities around the digital divide, connectivity, subsidizing some of this equipment and the MiFi, et cetera. So you can reach out to DIFTA, and DIFTA has put out tens of thousands of free tablets, et cetera, to help support getting people connected.
Great, thank you. Carolyn, I know that we talked about these new hearing devices that are going to be over the counter and less expensive. But are there any specific programs for lower cost hearing devices and or insurance for hearing devices?
Sure. Well, our first recommendation would be to be upfront with the audiologist that you're working with about your financial ability, your budget, your what your range would be, because you really shouldn't work with an audiologist who only offers you one model at one price. There are many, many prices available, many different types of levels of technology. So that's our first recommendation. Do look into your insurance. Medicaid does cover one hearing aid typically, and Medicare traditionally had not covered hearing aids, but there are some HMO plans. There are some other insurances that like AARP insurance for hearing aids. So I would look into that as well. And then there are some social service agencies that might be able to help you if they have non-discretionary funding, like funding that is available for a case manager or social worker to allocate towards the purchase of a hearing aid. So that's something else you could explore as well. I hope that's helpful.
Yes, thank you. I think this is really, the next one's for Chaiwoo. People are starting to hear about things like home robots that can be helpful to you in the home. Do those really exist yet? And is there something we should be knowing about them?
They do exist, but I would say that it's at a very early stage. So there's things like the animatronic pets. That's one example of the robotics applications that we see right now, but there's also more advanced models that can move around, for example, and look for someone, and to facilitate communication between healthcare providers and family caregivers. But being at such an early stage, they are very costly right now. And most of what exists are things that could be cost prohibitive for individual homes. So we see models such as an assisted living or a nursing home buying one and sharing among its residents, for example. Some of the providers exploring subscription models. And we see in other countries and other cultures where robotics was more readily accepted, such as Japan, where there's also subsidies that are now in place to facilitate adoption of some of these technologies. But again, these are at a very early stage. For example, Amazon has a beta model right now, but not ready for kind of the mass market distribution. But yeah, there's a lot of promise right now. I do see a lot of efforts, a lot of new models that are just being introduced in the past couple of years. So we may see in the future these robots being used to assist caregiving, to assist aging in place as they get, as the cost lowers and as they get more accessible.
Thank you. I'll just point out also, there are these devices called Alexa that are connected to Google, and they might be with other systems too. I just tell my Alexa my shopping list when I realize I need something. And then when I'm out, I actually can just look up the shopping list on my phone because it transfers it to my phone. And it's like, I'm so excited with my own skill set that I figured that out, a way to actually remember what it is I'm supposed to be remembering and don't remember when I'm near somewhere that I can actually buy things. So people who know what those Alexa devices are, they are a little intrusive. Mine likes to jump into conversations even though I haven't asked her to. And she tells really bad jokes because my husband keeps asking her to tell him jokes. So she has a terrible sense of humor, but there's a technology that might come in handy for a few things. So we have some people talking about how they need more help to learn how to use all the equipment and that they're not techies. And again, there, I think I'm saying, take a look at the materials Marco was offering and take a look at the classes they offer and the training they have, because I think that can be really helpful. But now I also have someone who said, I'm a former adult business educator and computer instructor. How do I get involved to utilize my skills and to help make this all more comprehensible to the public? So are people looking for volunteers to help? Or I'm not sure this person was actually looking for a job, but are people looking for volunteer assistance? I guess that might be Marco as well.
So at this time, Senior Planet isn't looking for any volunteers. However, we're always looking to, for people with interest, and whenever there's availability, we reach out to individuals. So I can add my email in the chat, and you can send, if you're interested, you can send your inquiry in, and we'll get back to you if there's a need.
Senator, may I?
Please.
Because there's three things you mentioned there I just want to address. So the network of aging professionals is always looking for volunteers to help teach the equipment. And I think what has been talked about is exactly right. Older adults absolutely use this stuff. They can be taught, additional skills. And the ageism, I think that Chaiwoo talked about is exactly right. But on your other 2 points, OATS does a tremendous job in what they do. I have been down to the Chelsea Center many times, but there's other platforms as well. We've partnered with Get Set Up. So any of your listeners, anybody over the age of 50 can, for free, sign up to Get Set Up, and they do exactly similar types of things that OATS does. They teach how to use mainstream equipment. We have over 600 classes that are revolving. It's a worldwide application, but it also allows people to get paid for skills that they have. If you're over 50 and you have a skill, like you're a quilter or you're a photographer, you're a cooker, you can sign on to teach a class and get paid for it. On the Alexa, we are launching next month with Intuition Robotics. this product called LEQ, and they're based out of Israel. And they do exactly what you talked about, that kind of Alexa does, only it comes with an iPad, and it engages individuals rather than many of the courses where I have to engage it. And it literally does exactly what you're talking about. And I can't get into all the details. It's super exciting, but we're going to be putting 834 of those units into the homes of older adults this year. It was designed by and for individuals over 75. 75% of them can set it up themselves within 5 minutes. The other 25% takes about 10 minutes with some assistance, and it engages in all aspects of life and health and wellness. I think about Chaiwoo Lee's pyramid, and those are the very factors that it really talks about, and it remembers what you said. I have to meet Bob next week for whatever, and it will remind me that morning, or ask me to do things, ask me how I slept, how I ate. It can communicate with caregivers and grandkids. It can upload pictures and so much more. We're really excited about that.
Oh, I'm excited about that. Great. Yes, I use it as my alarm clock as well. It wakes me up in the morning. It tells me that it will give me choices of music to lull me to sleep. And she just inserts herself without my even asking. I think I just have a very bossy Alexa. So she just decides to jump in regardless of whether she's been asked anything. This is such a common question. Doesn't matter what your age is. How am I expected to remember endless usernames and passwords? Anyone have a good idea?
I write them down. We got the same problem. There's so many and they change all the time. You got to write them down.
Nope, nobody else has got a great idea. Are we going, maybe for the researcher, so people talk about them are shifting to like bionic, it'll look in your eye and it will know it's you, and then you won't have to tell it anything. Are we getting closer to that model?
Yeah, so we do think about different modes of authentication, and if that gives people, in addition to the actual accuracy and security, if that gives people a sense as to increased security and more convenience, or if that feels more intrusive to some people. We haven't done any research around that, but yeah, we do think about how different modes of interactions, because we see a lot of shift in terms of how people use technology and interact with technology in general. So just a few years ago, a lot of devices use buttons and dials, and now we see voice and gesture being used more often too. So there might be a shift in terms of how the authentication happens with some of these services and devices. But it'll be important to think about not just the accuracy and the objective security, but how people feel about that.
Well, and the Apple products can use a thumbprint and face recognition. However, the downside of that is when you get an update or an upgrade, you have to remember your password in order to get back in. So that, if you're not using your password very often, it actually has a negative impact.
Yes, no, I mean, I think even the 13-year-old tech geniuses in our lives are facing the same reality of how can there be this many different passwords and code numbers, and some of them demand you change them every couple of weeks, and even if you write them down, then you can't find where you wrote them down. It's just this continuing saga. Is there any way to connect to the internet if you do not have Wi-Fi in your apartment or house? I guess that's a very individual tech question, but
not that I'm aware of.
Okay.
But I wanted to mention that, the Link NYC stations, kiosks throughout New York City, on all the street corners, have Wi-Fi. And that is one way you could connect. Of course, you need to be standing within a certain number of feet near the kiosk, but that is an option. And maybe public libraries.
Oh, that's true. Public libraries definitely have access. And I don't understand this, but I hear people talking about this, that if you have cell phone service, it can become somehow a hotspot as if it's Wi-Fi for you.
Correct.
And I don't know how to do that, but apparently That does exist with some phone systems. So if you don't have Wi-Fi, but you do have a cell phone, you might want to just go check with whoever you get cell phone service from. They might be able to tell you how to do it. Okay, there are many different individual questions. Let's see. People are asking about streaming devices on their TVs. And I think that's way too individual. And yes, if you have old TVs, you might not be able to do some of the new modern high-tech options that are involved for streaming different stations, etc. Email addresses and cell phone numbers are becoming more important for identity and account verification than anyone ever expected. And what about concerns about privacy and safety from identity theft? And are we thinking through those questions for older Americans in the research studies that are going on? Or are there things we should be thinking about legislating that recognize there are all these additional new security issues for people? So I guess I'll ask Chaiwoo and even Greg Olsen.
Yeah, so I think that also goes back to the authentication methods that we were talking about earlier, and thinking about, so we've thought about the issue of elder fraud too, and how that sometimes uses the fact that some of the older adults that are talking to might be less experienced with new technologies and ways of using technology, and how the lack of understanding of how some of these new interactions work might put older adults at a disadvantage and a risk for identity theft or even physical harm, for example. And we haven't found a good solution yet, but consumer education is definitely necessary, and not just for older adults, but also for younger adults too. Just thinking about people at the younger age spectrum. So thinking about my children, for example, and how they might learn to interact with technology, how they might learn to share information about them online. And I think it really goes across generations to let people know that what they share online, what they share using different technologies and where those might go. And also for service providers and technology providers to be more transparent about where things go. Because what we also see is that even if information gets shared, if there's added transparency and if people can understand where things are going and know that there's some level of control that they have, they feel more comfortable doing that. And it really builds to their knowledge and their confidence.
Okay.
Yeah, I would wholeheartedly agree, but I think I'm going to take a little different spin. The FTC reported that older adults were scammed out of $440 million in 2019, and that only increased during the pandemic. There are, I think that folks don't really understand how much of our information is out there, especially when you're using, devices in Facebook, and the scammers are incredibly smart, but they're using pretty low scale ways to reach people. A text message with a link, something that looks like a bank statement to touch a link so that malware is on your machine. So there's some real easy things that people should be doing. Which is never giving out any information on the phone. If you don't recognize a phone number, don't pick it up. If you're getting text messages and emails that have embedded links in them, do not click them. You can always call whoever it's coming from. But I'll give you two examples of things that are pretty scary. There was a scam with my name on it that a woman got in Florida. She looked me up, saw what I did. It was aging related, thought it was legit, clicked on it, and it wound up installing malware on her phone. So we had to work with the feds to get a nationwide alert out on that. In Broome County, the Binghamton area, there was an alert that came out that looked like it came from the Emergency Operations Center on a storm that was coming. That was also a scam. So if you think that you've been a victim of a scam or identity theft, reach out to the FBI and the New York State Attorney General's office. You're not alone. This happens to far more people. And I agree, this is not an older person issue. This is an all person issue.
Absolutely. And you could also reach out to my office. We put out some materials about targeting scams, particularly to older New Yorkers, but they apply to everyone. So you can also ask us for the materials that we have put out about scams and what to do about them. I think I only have time for one more question. Um, there's so many about that they can take our information and they're taking our information, they're selling our information. We should do something about it. And I agree. And I think government has a lot of work to catch up with the technology and what we should not permit. But one that I'm not sure is an urban myth or not, so I definitely want to ask it. So can they actually, whoever they are, hackers, companies, whomever, can they actually get into your computer in such a way that they're turning on your camera and watching you and what you're doing in your own privacy of your bedroom or your living room? Is that like a bad movie plot, or can that actually be?
That can actually happen, and it usually starts off with a phishing email where someone says your information's corrupted, please, and usually it's, they put a logo of like a well-known telecommunications company, and then they say, give us a call. Individuals give that number a call, and then they're able to access through walking them through the process. That's how they get people to give them access to their computer. And they steal information that way. They can turn on their cameras and they have access to it. They can lock people out from their computers completely. So that is something that you'll find it in a bad movie, but it also happens in real life.
Yeah, the other way is exactly as Marco said. You might get a message, a brick on your screen from what looks like Windows that says there is malware or something wrong with the computer. Click this button to give us remote access. And then exactly what he said happens, whether it's your camera or not, or getting into your bank accounts, et cetera. It's supposed to look like they're going to fix your machine. That is not true. That's a scam. But that's the most common way that people wind up getting into other people's machines, besides leaks and hacks that we read about in the news all the time with bigger companies and stealing credit card numbers and things of that nature.
Wow. Well, on that note, so it is buyer beware. Everyone try to be smart. If something seems to be going wrong, reach out to the resources you learned about today, to my office, so that we can help make sure that bad things get cut off as quickly as possible. I want to thank again Marco, Carolyn, Greg, Chaiwoo, my staff, Wendy, Justin, Brad, who I couldn't get these things operating and on the air without. We have one senior roundtable session left for this year, and it'll be held on Thursday, May 19th. And we're going to be focusing on older adult advocacy issues and how to be a stronger and better advocate on behalf of older adults. I want to thank everyone for joining me today. And again, you can access this this webinar either by my sending you an update in a couple of days if you're registered, or you're actually going to be able to find it online as well through my website. So every time we do one of these and we check back a couple of weeks later, more and more people have watched them. So I'm very glad that these are being used as a resource by people, even who can't join us the day we're doing it. So again, thank you to everyone. Have a great day. It's beautiful out today. Take care. Bye.
Thanks everybody.